Colposcopy essentially means examination of the cervix. So colpos is cervix and scopy is examination. So colposcopy is a secondary screening tool when one has had an abnormal cervical smear to diagnose any pre-cancerous conditions on the cervix. It is not a tool to diagnose cancer. The smear is not a tool to diagnose cancer. So basically what we are doing is we are examining women who have had abnormal smear to find out if there is a pre-cancerous area on the cervix from which these abnormal smears have been obtained. Smear test is a primary screening tool. So um, during a smear test, often done in the general practitioner's surgery by a practice nurse, we use a speculum to identify the cervix, and then a sample from the cervix is taken to analyze for two things. Number one, whether there is presence of high-risk human papillomavirus and whether there are any abnormal cells which are precancerous. When you have an abnormal smear, which is if there is presence of high-risk HPV and an abnormal cell, then the next step is to do a colposcopy examination. And colposcopy essentially is to diagnose pre-cancer of the cervix. Although it is essentially used in the screening program to diagnose pre-cancer, we can often use it for other purposes, like if someone has had an examination and has been found to have an abnormal or an unusual looking cervix, then the next step is to do a colposcopy to identify and check it thoroughly. So for the patient, colposcopy is almost similar to having a smear test, but it just takes a slightly longer time, because for the physician, what we have to do is to apply some special stains to the cervix and use a magnifying lens, a telescope, to examine the cervix thoroughly. And that can take a few minutes, because when we apply a stain, we have to wait for the stain to be taken up by the abnormal or the normal cervix. And for us to be analyzing that area can take up to 3 or 4 minutes. It's usually not a very long procedure. It's usually within 5 minutes. One should be able to tell the women whether the cervix looks normal or abnormal. Colposcopy per se is not a painful procedure. If you've had a smear test and you felt comfortable having a smear test, then colposcopy is almost exactly like having a smear test. So per se, colposcopy is not a painful procedure, but I understand many women have pain during an examination or having a smear test. So the pain during smear test can be reproduced whilst having a colposcopy. After the colposcopy, we will wait for either the biopsy. If we've done a biopsy, we'll wait for biopsy results to come back. Or if we've done a smear, we would wait for the smear results to come back. More often than not, if the colposcopy examination has revealed a normal looking cervix, then there is no further intervention needed. More often than not, women have a brownish vaginal discharge after colposcopy, and that is due to the use of a iodine stain